Are you thinking about a facelift? Let's get into what really matters. We're going to compare two popular facelifts, a ponytail facelift and an inside out facelift. You'll learn the truth about scars, how long you'll be in surgery, and even what you'll pay. After all, it's all about making the right choice for you. So let's get the facts before you decide. As I like to say, scar is the worst four-letter word in plastic surgery. So when you think about a ponytail facelift versus an inside-out facelift, that's a huge advantage, is minimal scarring. If we look at the ponytail lift, if you're doing an advanced facelift in an elderly, you do have some scars in front of the ear, just not in front of what's called the tragus, but you do on the earlobe. You also have scars behind the ear and into the hair. Another place you have scar is across the chin. And most objectionable is you have a scar across your lower lid. Now, if you look at the inside out facelift, you don't have any of those scars exposed. You don't have a scar on the eyelid, in front of the ear, behind the ear, or on the chin. The reason that you don't have scars with both procedures is that you start in the hairline. On the ponytail lift, you have 2 incisions on each side, so you have 4 total hidden in the hairline. On the inside out facelift, you only have 2 incisions because the 2 are combined into 1 for more efficiency and less scarring. On the ponytail, you have an incision across the eyelid, so it's an external scar. On the inside out facelift, you don't have that scar because I'm going up through the mouth, through the nose, I'm going behind the eyelid, so everything is hidden at the deepest layer. When you get to the ear region, on the ponytail facelift, you take off part of the earlobe and make a small incision in front of the ear. You go behind and you go back, and with an inside out, there only is a single small incision behind the earlobe, but the earlobe is not detached and you don't have any scars in front. When you get to the neck region, on the ponytail lift, you have what's called a submental incision. It's an external scarred incision to work on the deep neck area. On the inside out facelift, I go through the lower lip down to the chin and down into the neck, so there is no external scar. So you get 2 incisions in the hair with the inside out facelift. You get 4 with the ponytail facelift. You get multiple scars that are pretty well hidden with the ponytail facelift. With the inside out facelift, they're 100% hidden. There is no exposed scarring on the face. The next big factor to consider is anesthesia. Fortunately, both facelifts are done under sedation anesthesia, which is the safest way to have it. You don't have to have general anesthesia. You're not intubated. You're completely breathing on your own. The next thing that happens with anesthesia is the amount of time that you're having anesthesia. With the ponytail facelift, it typically takes about 10 to 12 hours. With the inside out facelift, because so many of those incision areas are avoided by going behind the skin of the face, then it's only 4 to 6 hours. It's about half as long for anesthesia. And I think most of us know that the less time your body is under anesthesia guidance, the more safe a procedure is. So we don't want to be under anesthesia any longer than you have to be. The last thing to consider is cost, or what I like to call investment, because you're really investing in yourself, because this is going to last for 15 to 20 years. You're going to look better, feel better, and it's been proven with studies that you have more successful jobs and things like that. So think of it as an investment. If you're going to get a ponytail facelift, you're going to pay on average about $100,000 to $150,000 for the lift. If you're going to get an inside out facelift, you're going to pay on average $50,000 to $75,000. So think about these different things, make the right decision for you, and keep in mind that you can travel all over the country with airlines, and that's a great way to find your best provider.